Okay. All right. Good day to everyone, and welcome to my live. I am Marcia Gordon, administrator and owner here at Marcia's Healthcare Registry. We are located in Broward and Palm Beach. Our code for today is be kind to diabetes. We deal with enough pricks.
I like that.
Okay. All right. Today is Health and Wellness Thursdays, and we continue to bring awareness to diabetes. And I want to welcome you, my guest, which is Marva Riley. She's an RN, an author, holistic health advocate, and international speaker. I also have my friend and Dr. Karen Lewis on the phone next to me here. Hi, Karen. Hello. I think she's probably put me on hold. Hello, Karen. Yes. Anyway, so let's go ahead, Marva, and get right into it.
Okay. All right.
Mm-hmm.
Okay. So thanks, Marcia, for having me. I welcome any opportunity to talk to everybody about their health and wellness. As you know, I'm a passionate advocate
Yes.
for holistic health, not just what we eat, but the exercise, the sleep, or spiritual walk or emotional health, decreasing the stress level, etc. Because we're a whole being. So we have to address health from a holistic standpoint, health including diabetes.
Mm-hmm.
So it's a pleasure being with you today.
Thank you.
Mm-hmm.
All right. So you can go right into your topic for the day.
We're talking about,
Yeah.
okay. So diabetes is one of the top disease states in the world, and it's becoming more and more popular because of the food
Mm-hmm.
that we eat. The standard American diet, the SAD diet as they call it, is spreading all over the world. You go wherever you go, you're seeing the McDonald's, the Burger King, the fast food joints. There are even fast food joints in the hospitals now. You know what I mean? So because of what we're eating, more folks are getting more and more obese and overweight. And with the overweight and the obesity comes the elevation of the blood sugar, and more people are being diagnosed with type 2 diabetes, which is a very, very preventable disease state.
Yes.
Very preventable. And it's not as complex as we think.
Okay.
Controlling the blood sugar, reversing type 2 diabetes, preventing type 2 diabetes. It's not as complex as we think. Just like hypertension. It's not as complex as we think to prevent and reverse hypertension. And I want to share some tips today that will help your viewers.
Sure. Right ahead.
Go right ahead. Okay. So I worked. I'm still a registered nurse. I just haven't worked in the hospital setting for about 7 years now. But most of my experience has been in critical care, and so I saw the sickest people coming into the hospital, and many of them were diabetic, and the diabetes leads to all kinds of other complications like kidney disease, liver issues, circulation issues, heart issues. Diabetes literally eats you up and spits you out.
Wow.
Okay. It affects every area of your life, your eyes, your brain, circulation, your lungs, just everything. You get sores. So if you can do anything to prevent diabetes, or if you've been diagnosed with diabetes, there are some things that you can do to reverse type 2 diabetes. And even if you have type 1 diabetes, which the folks that have type 1 diabetes are usually born with it. The pancreas isn't working well from childhood, from birth. But even with type 1 diabetes, or juvenile diabetes, as they would call it, you can maybe not necessarily reverse it, but you can control your numbers. And there are some physicians that I follow, like Dr. Milton Mills, who is a Seventh-day Adventist physician.
I followed him. I followed him.
Yeah,
Yeah.
yes. Dr. Michael Greger, Dr. I have one of his books here, Mark Furman. They will all say, even if you have type 1 diabetes, that too is possible to reverse it if we're willing to do the work by changing the way we eat and incorporating some exercise. So you have options.
Wow.
Any question? Any question for me? Because I can keep talking, you know.
If there are questions, they normally put them in the chat.
Okay.
So you can keep talking. Yeah.
Okay.
Yeah.
All right. So the way we treat every disease state, for the most part, in a nutshell, need to be treated holistically. Whether you have issues with your brain, whether you have issues with depression or anxiety, sleeplessness, whether you have issues with your heart. I had cardiomyopathy, and they told me, the doctors told me years ago, when I was diagnosed with cardiomyopathy, I couldn't breathe. I was 38 years old. I couldn't breathe. I couldn't walk up and down flights of stairs. My heart rate was very, very fast. The cardiologist told me that if I didn't have heart transplant, I probably wouldn't live. But I didn't believe that. Okay. At that time, I was diagnosed with depression and anxiety, insomnia, acid reflux, H. pylori, and all kinds of other health issues, because they all interconnect, right?
Okay.
So yes, I had to have a heart procedure done, and the physician told me that I needed to change my diet, start walking 30 minutes a day. He said, try yoga and prioritize your sleep and relax. And I was so desperate to be healthy because I had 2 young children and a husband. I followed the doctor's orders to the T. I changed the way I ate. I found some Seventh-day Adventist physicians that teach healthy living, and I followed it. I'm primarily plant-based. Very rarely do I eat any meat or fish or anything. Never eat pork at all. I'm not Adventist, but I don't eat anything pork-based. I don't eat any processed meat or anything like that.
Okay.
But just by changing the way I eat and incorporating more vegetables, more plants, more broccoli,
Yes.
more apple,
Of course.
and less sodas and less juices, and drink water or herbal teas. Like, you know, I'm drinking herbal tea with some here I have ginger, turmeric, and some lemon juice, a little bit of honey. Drink that instead of sodas and juices. I was able to start losing a lot of the weight because overweight and obesity is linked to heart disease, to high blood pressure, to high cholesterol, to diabetes, arthritis, gastric reflux, all those things. Overweight and obesity are linked to those things. So once I started shedding the weight, and even overweight and obesity linked to sleep issues and anxiety and depression, you know.
I think
So
I'm
once
there.
once you start working on the diet and eliminate some things, eliminate the sugar.
That's my goal.
Yes, eliminate the sugar. Yes, start working on it.
Yes, I started. I told Dr. Karen, we're gonna start.
Have to start having, because guess what? Our health is our wealth.
Yes, it is. It is. And
We
without
have been
nothing.
nothing, because you know, nothing, absolutely nothing. I have a very good friend who's very good friend. She is a multimillionaire. And recently she started having headaches and headaches. And the diagnostic test led to diagnosis of brain tumor. And then they did more diagnostic tests, and they said, we have to go in and take the tumor out. The surgery was supposed to be 4 hours. It ended up being 8. And then now she has complications related to the surgery because they inadvertently introduced bacteria in the brain. So she has meningitis, you know, and this lady is very, very wealthy, but She doesn't
Right.
have her health anymore. That's the point I'm making. She doesn't have her health anymore. She's just struggling to survive. Okay. So sometimes we take our health for granted, and we cannot
Mhm.
take our health for granted.
Yes. We
You know,
always
we can't
and we don't take care of ourselves. I'm guilty of that. I'm trying to slow down to try to take care of me.
have to before it's too late.
Yes, you're right.
Before it's too late. And you're never too old, never too young. It's never too late to start. You can start now. Just start making. No, I'm not
Oh,
necessarily saying that you're going to jump
right,
to eating a whole head of broccoli
right.
right away, but
Hmm.
you can start by incorporating a small salad daily, for example. That you increase the amount, you could do a small salad
Right.
and some steamed vegetables, some beans. You're going to hear Dr. Milton will talk a lot about beans, because a lot of people think that in order for you to get enough protein, you have to drink milk, or you have to eat fish, or you have to eat chicken or pork. You
Yes.
don't. You, beans and nuts and seeds and broccoli has lots of protein. Even oatmeal has protein. You get all the protein you need from plants.
Mhm. Okay.
Okay, and also the plants are so, and like the fruits and stuff and the nuts, they're so rich in fiber, and the fiber helps to control blood sugar, because we're talking about diabetes.
Right.
The fiber also helps to decrease the appetite, helps you to feel full.
Hmm.
And the fiber food, like the broccoli and the fruits,
Hmm.
they have less calories, so they'll keep you full, helps to help to reduce that cholesterol and that blood sugar, and also help you to lose weight, because you're full for longer and has less calories, so you won't eat as much, and so
Right.
you lose the weight.
Okay.
So you can't go wrong eating more vegetables, more fruits, more nuts,
Mm.
drinking water, getting rid of that sugar. Sugar is inflammatory, and anything that you don't prepare from scratch has
Mhm.
sugar.
Wow. Mhm.
When you read the back, it might not say sugar, but it say fructose, high
Fructose.
fructose
Yeah.
corn syrup and things, and other names that you never even heard of. It
Yes.
has
Yes. Lord.
sugar.
Yeah.
Yeah.
Really. Oh
Because
my.
the thing is that they want, it's by design, in my opinion. The
Mm.
food and drug industry want us sick. They want us sick, broke, anxious, and stressed out,
Mm.
because because the health is a is an industry. And if you don't have sick people in the hospital doesn't make money. If you don't have sick people, the pharmaceutical company can't make money.
Oh, okay.
Okay.
Hmm.
So sugar is placed in foods to get us addicted to these things, because Coca-Cola and Pepsi is very addicted. You're gonna have to have it every day. That cup of coffee with the 10 packs of sugar is addictive.
Mm.
And so the more addicted we are, the more money these industries make.
Okay.
So well, I know you're in the health industry. I'm not talking about you.
I know. We're
Oh,
just bringing
mm,
awareness,
yes, yes,
out there.
yes, awareness.
Go to their doctor,
And
they do what they have to do, but we're just,
mhm,
bringing some awareness across the board.
yes, and showing folks that there's another option. You don't
Yes.
have to have one foot in the grave and one out.
Yeah.
So that's our diet. The next thing is to incorporate some moderate
Yeah.
exercise to your daily routine. The American Heart
Mm-hmm.
and the American Cancer Society and the World Health Organization, they used to recommend 30 minutes of physical activities per day. But
Yeah.
the other day, I was listening to one of the physicians that I listened to, and he said, Dr. Kim Williams is another guy you might want to follow. Dr. Kim Williams,
Mhm.
he's a cardiologist, and he said the American Cardiology Association, the American Heart, and the World Health Organization have increased the time for activity and exercise from 30 minutes a day to 45 minutes a day. And
Wow.
that helps our mortality, helps our heart,
Mhm.
helps diabetes, helps whatever issue we're having, sleep, anxiety. So we should be shooting for a minimum of 30 minutes of physical activity. You're in Florida, There's
Yeah.
no reason why anyone in Florida should not be out there walking. There's so many parks in
You
Florida,
know,
free parks.
I love to walk. I'm walking. I'm also doing my walk video in the morning.
Good, good walk.
Yeah,
Sleep is very important to Marcia.
I know that. I'm
Um,
sure I need to get some more sleep.
yeah. Sleep, lack of sleep and anxiety increases our cortisol level,
Hmm.
and that increases inflammation in the body, and that increases blood pressure, cholesterol, heart disease, and diabetes. So it's very important. The recommended number of hours is 7 to 8 hours of sleep per night. And some of the things that folks can do is just set your alarm on your phone,
Uh-huh.
decide, well, actually decide in advance,
Hmm.
what will my 7 hours or 8 hours look like? Will it be from 11 to 6? Will it
Hmm.
be from 10 to 5? I mean, you decide. So suppose bedtime, you need to have a set time to go to bed and a set time to wake up. So suppose you say, okay, I'm going to get to bed at 11.
Hmm.
You've made that decision. Put an alarm on your phone or wherever so that quarter to 11, you get an alarm. Remember, you're going to bed at 11. At 11 o'clock, whatever is not done,
Down.
shut the computer down or whatever you're doing and get into bed. Well, you're going to have to brush your teeth
Yeah.
5 minutes or so before. And then you get to bed at 11. Eventually, you won't even need an alarm because the body will just remind you it's almost 11 o'clock, time to wind down. And then 11 to 6 would be 7 hours. It's not so bad.
Not so bad. Yeah, I'm gonna practice that. I need to do that.
Yes.
Wow.
Drink water instead of coffee. Too much coffee. A cup is fine, but too much coffee inflames the body and it
Hmm.
makes the body uh, too acidic. It's toxic to the body.
Okay.
So that's another thing that folks can start doing, decreasing their coffee intake. And if you do have coffee, have black coffee, no sugar,
Hmm.
you know, no sugar. Um, but the essence of it is that we have to be sick and tired, like you said, of pricking our finger,
Yeah.
of injecting insulin in our body, of taking pills. When you get to that point, and also when you're diabetic, you don't feel good. You just
Hmm.
don't feel good. When your sugar is high, you don't feel good. So you have to get to the point where you're sick and tired of feeling that way, of taking drugs, of taking insulin, to taking diabetes, because diabetes pills also, like every other pills, comes with a lot of negative side effects. So another thing that folks need to do, they need to know what are the side effects of these medications that I'm on,
Okay.
and know now if it can lead to this or lead to that, then like I have a family member that has been on metformin for years, and recently his platelet tanked, like a year ago. The doctors just couldn't get the platelet up, couldn't get it up. He went to see a hematologist, and she felt strongly that it was two of the diabetes pills that he was on that had destroyed his platelet. So she took him off it completely,
Okay.
and it took 8 months. Well, she took him off the diabetes pills,
Hmm.
put him on insulin, put him on steroids. And the thing is that it was like a domino effect, because the steroids drive up the blood sugar. So he had to be taking a higher amount of insulin. But she wanted to juggle that until all of that diabetes pills got out of his system. And in 1 year, the platelets started going back up. So all these drugs have negative side effects. So if for nothing else, you should want to get off it. And if you want to get off it, you will make the decision that I'm going to do whatever is necessary.
Hmm.
I'm going to do what I'm going to try. Yes, you're not going to be perfect. You're going to fail a few times. You just hit that reset button, start again,
Right.
and start again and start again until the healthy lifestyle become your lifestyle, and it gets relatively easy.
Awesome.
And but then you'll be able to get off all those medications and stuff and start feeling good and live a long, healthy life.
Awesome. What about I see you doing a lot of intermittent fasting. I like that.
Yes. Yes.
Yeah, so
I was introduced to intermittent fasting when I was sick some years ago. Um, my body actually was forced to go into a fast because the only thing I could tolerate at that time was boniato, sweet potato. Everything else made me very sick. I was a size 8 and I dropped to a size 0 because I couldn't eat.
wow.
And my husband said to me, you know, you're going to be thankful that your body did this for you because your body is very smart. It's forcing you to go into a fast so it can heal itself. And it was true.
Yeah.
And so I started practicing intermittent fasting because when I did my studies, I realized that the H. pylori and the GERD I was experiencing,
Mhm.
that the doctors kept doing endoscopy and putting me on drugs, wasn't helping. That intermittent fasting can help to heal that. And it did. So generally speaking, I do at least 12 hours of intermittent fasting every day. But
Wow. Right.
usually I
Mhm.
do 14 to 16 hours of intermittent fasting every day. It helps you to lose the weight and keep the weight off for good. And I address that in my weight loss book. Um, Intermittent fasting helps you to lose the weight and keep it off. If you have digestive issues like acid reflux, H. pylori, bloating, that kind of gas and stuff, it helps to heal that digestive tract.
Okay.
The intermittent fasting helps to reverse inflammation or clean up inflammation. You're more clear minded. If you have joint pain and stuff like that, it helps that. It's just amazing because the thing is that our bodies heal when we're fasting, when we're not eating.
Mm, interesting.
And when we're eating, it takes in nutrition. When we're fasting, it's healing. So God never intended really for us to be eating at night and eat so much. We eat too much.
We have to have a cutoff.
Yes,
Cut off.
you have to cut off. You have to cut off. You know, I love to talk about Daniel.
Mm,
And
yep.
Daniel, so many people think that Daniel and this fasting was a short period of whatever.
Mhm.
Daniel ate like that all the time. And what did Daniel eat? Plants, fruits, vegetables, nuts, and grains.
Yes.
Not the King's meat, not McDonald's meat, not Burger King food, not Popeye's food, not the fast food in the supermarket. He said, listen, if I don't look better, Daniel said to the king's men, if I don't look better and I'm not stronger after the few weeks,
Mhm.
stronger and
Mhm.
look better than the other guys, then I'll eat whatever is on the king's table. But if I am stronger and look better, then will you allow me to not eat the
Mhm.
food from the king's table? And they were stronger, awesome looking, strong men, lean, because they ate real foods as opposed to the fake foods that's available. We shouldn't be eating ham and turkey and those things. They inflame our bodies.
Mhm.
You know,
Okay.
too much sugar inflame our bodies, and our body is a temple of God. So we've got to take the best care of God's temple.
So true. I think we have a question in the chat here. Um, Sharnette Fisher says, "Do you believe sweet and low is good substitute for sugar?" Nah.
Sweet and low is bad. Sweet and low is linked to cancer in rats.
Oh,
So it should not be consumed. The thing is that we're addicted to sugar.
yes, you can ask
Charnette,
your doctor.
say that again. Huh?
No, I'm
Say it
telling
again.
her she can ask her doctor that too.
Oh, the
Because
doctors don't know. Let me tell you something. The doctors do not know. You have to do your own
own
research. There
research.
are some physicians that are
Mhm.
savvy
Yeah.
and they're on top of things, but most doctors, well, I think every doctor will tell you that they were never required to study nutrition at length in medical school.
Okay.
They were not.
Online? Hello? 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 I think she's off. Okay.
Okay.
You're hearing? Yeah. We had someone in the chat was asking a question about sweet and low.
About what?
Sweet and low. She was asking if sweet and low.
Yeah, I know. The sugar alternative.
Yes. Yeah.
All of them have their side effects, so the best thing is to avoid them completely.
To avoid them completely. Yeah, sure.
That's the medical doctor saying that?
Yes.
Okay, so Charnette, you hear what I said? None of them. If you can drink your
Yeah.
tea without any sugar,
Sure, yeah.
that's good. But you know what I have in my tea here?
Uh-huh.
I have a teaspoon of raw, organic, unfiltered honey.
Oh, honey, yeah.
But I
Honey.
mean, don't overdo it now. But if when you buy honey, don't buy it at the regular supermarket because their honey is 25% honey and 75% sugar. So you go somewhere where they have the real honey and you put a half a teaspoon of that honey in your porridge or something like that. But the best thing really, if you could not
Right.
have any sugar, but if you do have a little bit of honey, it sweetens it, and honey is also anti-inflammatory, so it's really good for us.
Okay, great. I wanted to give away one of your books today. I ordered one. I think it's on its way, but I also wanted to give away one. I'm looking in the chat. I think Sharnette is there, and then we have Turner, we have Gary, we have Olive. So we probably just need to probably ask a question and then see who
Okay.
comes up with the answer, and then I'm gonna buy one of your books and I could give it away
Okay.
today. So do you have a question to ask them what you talk about so far, and then we'll see who get the answers, who was listening to you.
uh, can I ask them just a general question? Is that all right?
Sure, that's
Okay,
fine.
to make it easy for them.
That's awesome.
how many how many grandchildren do I have?
Oh, it's gonna be a good guess. Okay, guys, you can put that in the chat, and then we'll see who come close or who's the winner, and then I will be purchasing one of her books and giving it away to you guys.
Okay.
Okay, so, huh?
Oh,
Okay, can you tell me if there's any answer, Mikhail? I'm not seeing.
any answer? Yeah.
Okay, so one says two, Olive says two, Charnette, which is Mel Fisher, says two. Okay, who else is there? Is there any more answers?
Not quite.
PJ
Okay.
is watching. PJ, how many grandkids do you think she has?
Zero, so no children.
Oh, how much you said, Karen? Dr. Karen? How much you said?
I thought you said she didn't have any children.
No, she says grandchildren. She's put in the chat. She says, how many grandchildren, right? That's what you said,
Yes.
right?
Yes. Yes.
But I thought she didn't have any children. I thought she didn't have any
Oh,
children.
yeah, Dr. Karen. I have two children. I have two grown children, and they have children.
And they have children, so we have to come up with a guess.
I must have missed that part.
Oh, I was calling you one at a time and I didn't hear you. I figure you're probably busy. Everybody's at work. You were busy. Okay, yeah, because I was calling her. I was calling on you.
I found a lizard in the house and was freaking out.
Oh, your son? A lizard? Oh my gosh.
Yes, well, the American kids love lizards.
Yes, yes. Our son found a lizard there and he was just freaking out.
Is
Okay.
he freaking out in a good way or scared?
Was he scared, Karen?
Of course.
It was a Jamaican kid.
Oh my.
So nobody guessed. Okay.
Let me see if anybody. Karen, Karen, did you make a guess, Karen?
Uh-uh.
No? Okay, so I have Sonia online. Sonia Brown, my cousin. She's watching. Do you want to guess how many grandkids
Marva has.
Marva has? We're giving away a book today. She's an author, and we're giving away a book. So can you make a guess? Can you put it in the chat so I can see it? Oh, she says 4. Oh.
Yes.
Oh my God, she won. Okay, congratulations to Sonia. She won. And as a matter of fact, she just came on, I think. Awesome.
Yes. Thank you for
Okay,
joining us,
so
Sonia.
all right.
Yeah,
So we're gonna purchase another one of your book. I did purchase one already. It's on its way, and
thanks a lot.
I'm gonna go try to see if I can lose some weight.
Okay, that's my this book, the weight loss book. I wrote this one last year because
Uh,
a lot of people think weight loss is difficult, and it really isn't. You just have to know what you're doing,
mhm.
and and I have like 12 steps in this book
Mhm.
to help you to not just lose the weight, because a lot of people
Keep it
lose the
up.
weight and they put it back on, but just keep it off for good.
Right.
And know that I know what I'm talking about, because I'm 61 years of age and I lost the weight several years ago and I have not put it back on. So I
Uh,
have some great strategies, and also my recipe book might be a good one for anyone who wants to who wants to learn how to cook
okay.
healthy
So the
plant-based
right.
foods. It would be another good one to help you to do that. My first book is my story of when I had heart disease. I was diagnosed with life-threatening heart disease. They told me I probably would not live if I didn't have heart surgery,
Mhm.
and I didn't believe that. God had another plan.
Yes, he sure
So
did.
I wrote how I was able to reverse heart disease. And then my most recent book, From Stuck to Limitless,
Yes.
it's this book I collaborated with 12 other authors on, and we all have a story of some ill health, whether
Mhm.
physical, mental, emotional health, that we were
Yes.
able to overcome. And there's one guy, one guy's one a co-author, and the other 11 are female. Excellent books, and they're available on Amazon, and they're cheap. They're only $10.
Okay.
They're great Christmas gifts, if
Right.
I'm sure people are
Someone was just asking where can we find them. They're on Amazon.
they're on Amazon, they're in Barnes and Noble,
Hmm.
Walmart.com, Target.com has some of them. But if you're an Amazon shopper, that's so much easier because you don't pay for shipping Prime
Right.
on
Right.
Prime, and they're only $10.
Okay. So Sonia, which book?
Yeah.
Ask her for the name for the book that
What
we're looking for so everybody can
What are
see.
the names of the books so we can put that in the chat? Go ahead, guys.
Okay. So my first book is Eat, Sleep, Meditate, A Nurse's Guide to Health.
Put those in the chat, Mikhail. Okay.
Eat, Sleep, Meditate, A Nurse's Guide to Health. And my second book is Share. It's an acronym for Simple, Healthy, Easy, Inexpensive Recipes.
Hmm.
And my third book is Lose Weight and Keep It Off for Good, Understanding the Weight Loss Game. And my third book is From Stuck to Limitless. Um,
Awesome.
if you're gonna buy on Amazon, if you type in Marva Riley, or if you go online and just type in Marva Riley,
Mhm.
Marvariley, I'm actually almost like a celebrity because I am on Google.
Yes, I see that. You're all over. Oh.
I'm on Google. I have had many interviews, so they're on Google,
Yeah.
and I have a YouTube channel also that folks can subscribe to. I give a lot of tips on YouTube
Yes.
on how to,
I'm following you
take back
all
your
over.
health.
I'm following
Yes,
you all over. Oh my God. It was such a
y-
pleasure to meet you from Facebook. People
yes,
to meet people from Facebook. This is my second person that I'm meeting from Facebook who is actually, I've came on my live before. I see you
yes.
follow her too. What's her name? Oh gosh, I
Melissa?
forgot. Yes. Is it
Oh,
Melissa?
Melissa Jane. I've been on the Melissa Jane show so many
No, not
times.
Melissa. No, not Melissa J.
Oh, okay.
The one that's in Dubai right now. She's in Dubai. What's her name? I have a moment right now. I
I
can't remember her
I know,
name.
I know, I know, I know who it is. I know. Yes, yes, yes,
Yes, she
yes,
was on my live. I followed her.
yes.
So and I
Okay,
just
yes,
started. Yes, I just saw her on
yes,
Facebook, and I just asked her if she could come on my live, and she says yes. And I was like, oh,
yes,
awesome. Yeah,
yes, yes,
awesome.
yes. I know who it is, right? I can't think of her name, but she's also she's a
Yeah,
Jamaican lady, and
she's
her
Jamaican.
husband is a white fella, I think.
Yes, yes, yes.
Yeah, I know who it is. We're in a another group together. it's
Yes.
just it's a small world.
I know.
It's a small world, and there's a lot to learn.
Mhm.
Facebook is a great tool to teach people and show point people in the right direction,
Definitely.
and meet like-minded
Definitely.
people.
A lot of
Um,
minded people on.
yes, like-minded people. Because I guess Facebook also suggests,
Mhm.
if someone is on the same wavelength and page as you. I'm on Instagram. My Instagram following is growing a lot, but
Yes.
I'm everywhere. I'm even on TikTok.
Yeah, me too. I'm trying that out. Yeah, I had my daughters
Yeah,
put me in TikTok.
yeah,
So, Sonia,
yeah.
I want you to put in the chat, Sonia, which book you would like, and I'm going to be getting that for
Oh,
you because you're the winner for
okay.
today.
Yeah.
So, you have a choice.
Congratulations, Sonia.
Yes. So, you have a
Yeah,
choice.
I just want to encourage everyone to,
Mhm.
just be serious about your health, because once you lose your health, you cannot regain it.
That's true.
And your health is your top priority. It is your
Yes.
absolute top. There's no excuses to you can't prepare healthy foods. You
Mhm.
can plan ahead. You can prepare steam some vegetables, say on Sunday, say when on Sunday or Saturday afternoon or something. A
Mhm.
whole bowl or pot of steamed vegetables, and you can make a whole lot of salad. You can even buy prepared salad in the bag, whichever is most convenient for you. But if you want to, you can prepare salad, put it in a container, and have enough for the next 5 days. You can cook some quinoa or some brown rice or bake some potatoes and have enough for 5 days. So you're not running to McDonald's or even go buy rotisserie chicken or anything. Like, you have home cooked meals,
That's right.
because the studies show that those folks who eat home cooked meals have less chronic health issues, because the stuff that you buy, even the rotisserie chicken, is not healthy because it has a lot of salt, and the food that you buy at the restaurants or whatever
Mhm.
has more salt than you would cook with, and other things that you don't even know what's in it. So you
Wow.
have to make time to prepare healthy foods. Get up 30 minutes earlier in the morning if that's what it takes, so you can get outside and go walk. And if you're living somewhere where it's cold, you can tune into a YouTube video or Instagram video or whatever video, follow a fitness person and
Right.
just do 30 minutes of their exercise.
Yes. That's what I do.
Sleep, you've got to prioritize sleep, because dementia is linked to lack of sleep. And dementia is one of those diseases that is taking over. So many people have dementia, linked to lack of sleep, linked to insufficient exercise, linked to eating too much sugar, linked to overweight and obesity, linked to stress. So we just have to take care of ourselves, prioritize our sleep, set that alarm clock and tell yourself, I'm going to go to bed at 11 and I'm getting up at 6, and just do it. Our grandparents did it, and that's why they lived to be 80 something and 90 something and 100 something, because they prioritize sleep and make time for fun. Whatever you like to do,
Mhm.
do it. If you like to go to concert, if you like to go to plays, if you like to go dancing, if you like to go to church, whatever you like to do that brings you joy and peace and you feel good, you need to do it. That's called the holistic lifestyle. That when you go back to see your doctor, he's going to say to you,
Okay.
what have you been doing?
Yeah.
Keep doing it.
Great, great, great advice. Oh my gosh. Okay, so Sonia says she wants the cooking book. All right. So I will be
Okay.
ordering that one for her.
Yes.
Right. So I just want to say thank you so much. I really appreciate you taking the time to come and speak with us today, and may God bless you and your family.
Thank you
And I
so
just
much.
want to tell everyone, remember the key to a healthy life is a healthy mind.
Yes,
And Karen, do
absolutely.
you want to say anything before you go? Dr. Karen?
No, great job, great job, great job, great
Awesome,
job.
awesome,
Thanks,
awesome.
Dr. Karen. Thank you, Dr. Karen. Thanks for all you're doing.
Yeah,
Thanks for being the advocate and
yeah,
helping
yeah.
people be well, become and remain the healthiest version of themselves.
Yes, definitely,
Thank
definitely.
you.
Yes, thanks,
Thanks for
Karen.
having me.
And thank you
Hmm.
so much. And thanks to everyone that has joined our live for today. Please remember to like, share, and follow us on Facebook, Instagram, and YouTube. Until next time, God bless. Bye,
Take
everyone.
care.
Thanks for
Bye
joining.
bye.
Bye.
Thanks for having me. Bye
Yeah,
bye.
I appreciate it. Bye bye.